So Peter, as a patient or a carer, what would you expect a healthcare professional working in an advanced level of practice to do to help you?
I think the crucial thing for me as a patient or as a carer of a patient is to know that the advanced clinical practitioner will treat me as a person. They will have the skills to identify and treat me as a whole person rather than just a specific pathway.
So how would you expect this to happen?
Well, I think that I'm hoping that the ACP would be one of the people I would see consistently. One of the difficulties in general practice or in a hospital junior doctor, they are often changing very quickly. And so therefore having an ACP who is as a committed member of the team might be the one consistent person that the clinician that you would see through your time in treatment. And I think therefore that it's likely that there's more of a long-term understanding of my condition rather than consistently regularly having to explain what you are. So I'm hoping that the ACP will be the key person of the team who I can relate to individually.
And so what are some of the benefits that you'd like to see from this level of practice? I mean, you've mentioned a few already, but what sort of benefits could you see?
Well, it makes sense to me that this is a really significant move. It seems to be something that is consistent and coherent within a healthcare system. So I'm hoping that the ACP would work with me to enable me to care for myself. I'm hoping that the ACP would support me taking back control of my own health. And as a result, I'm hoping that I wouldn't have to go into the acute care as often, perhaps, as I might have to at the moment.
How can you as a patient see this working? I mean, again, around the things that you've just mentioned, but how would it actually work in practice?
Well, for example, in the community, they'd be responding to my needs. They'd be challenging, perhaps, or supporting my own decisions on my health, if that was in a care home or in the community in general practice.
So this sounds like it would really be better for you. Is there anything else that you think that could?
Well, it does seem to me, as a patient and as a taxpayer, that this is actually a better use of resources, because we've got to be careful. I mean, it will be both effective, but also I think likely to be efficient and demonstrably as safe as other methods. So safety is crucial. We need to ensure that our patients are safe. But I think there's some evidence to say that there is improved outcomes as well. I mean, not just in the clinical outcomes, but in patient understanding and patient responsiveness. And I think that being treated by a skilled and motivated clinician is going to be really significant for me as a patient too.
That's great to hear. So did you want to ask me some questions?
Well, I wanted to know really how can you deliver the benefits that I'm seeking?
And I think that's a really crucial question. I mean, the framework was kind of a line in the sand, isn't it? The Advanced Clinical Practice Framework. And I think that is about trying to get some consistency, isn't it? And hopefully, once we've got that consistency, everyone's working to that point, isn't it? And alongside that, then we've got the opportunity to really start to get some research that would really start to evidence the benefits, to get that research in collaboration with service users and the public, and really start to explore that, evaluate, what does it really do? What are the outcomes? What are the impacts? What are the benefits? And alongside that, we're building in structures that would hopefully enable us to really assure the quality and the safety from your perspective. And also to really make sure that we're auditing, we're keeping track in terms of what some of those impacts might be, negative and positive. We're not just looking for the positive, we want to see both to really see if we can start to make that difference. If there are things that need to be corrected and changed, then that's what we'll respond to, and that's the idea. So I think research, audit, the framework, consistency I think that's really key to wrap around that.
I look forward to those, to seeing the results of that. So with an advanced clinical practitioner, I can expect to see a highly experienced clinician who will be able to look beyond a single condition that I've got, and who will coordinate with the team to help me manage my own condition and improve my care. Thank you very much indeed.
Thank you.